Hello, everyone, and I'm so pleased to be with Congressman Derek Kilmer. He is somebody I'm known and stayed friendly with since Congress, and he's just been a wonderful member of Congress. He represents Washington's 6th district, and I think 3 terms in, if I got that right.
Four. Yeah, hard to believe.
So at 4. I was wondering, how did you already do so well by just 3 terms of 4? That's great. Good. That's terrific. And he's on the Appropriations Committee. And for the purpose of this conversation, he's been a friend of Better Medicare Alliance and gave a wonderful video that we used at our annual dinner. That was great. I may make you tell that story again about your grandmother. It was terrific. And he's really been a friend to Medicare Advantage. So delighted to have him with us. And we'll have a few questions for you. So we'll just start in with a bit of a conversation. You have been a champion of Medicare Advantage, and we really appreciate it. But it's really hard in these times not to start a conversation with healthcare stakeholders without some conversation about COVID and the public health emergency, the pandemic that we've all been living with. It's obviously affected seniors in particular in terms of stay at home and staying in isolated, and Medicare Advantage has been very attentive. Our providers and plans have been very attentive to getting them the care and services they need to take care of their chronic conditions in the midst of this, as well as taking care of some of their social needs as well. But let's just start off with, this pandemic started in Washington State. So you were, somewhat on the front lines of this whole pandemic. And so what's your assessment of where we are currently, and actually where do you want us to go? This is not going away right away. So what do you want to tell us about what we might see going forward and what you hope for?
Well, I think, and first of all, it's good to see you, my friend. It's important to look at this through a couple different screens. One, the public health screen on trying to crush this virus. And, certainly there's a tremendous amount of research underway around treatments and around a vaccine. That's important. We're obviously further along today than we were when this first hit in Washington State 7 months ago. Having said that, we're still not where we need to be as a country in terms of the public health response around testing and contact tracing. In fact, I just hopped off a call with an epidemiologist who was talking about the importance of expanding our testing capacity just so we know who has this virus and can isolate that person, contact trace to make sure that we're not seeing further spread of the virus. As you look at what's worked in other countries, that's really been the main thing that's worked. The second piece of this is the economic side of it. And it's been really tough. I know you served in Congress. You probably would have handled this the same way I do, which is when our office gets outreach from someone who's lost their job or lost their business because of this pandemic, we're not sending them a form letter. I'm calling them. And, we just hear tremendous pain. Earlier today, I talked with a senior who had written in and said, I spent 50 years of my life working and was planning on spending my retirement traveling the world. And I've been stuck in my home, and that's really hard. And, I talked to a mom in Port Angeles, which is my hometown. And she said, she was 54. She said, I've worked my whole life until this March. And she said, I used to organize the food drive for our local food bank. And she's, for the first time in my life, I had to go to the food bank to just feed my family. And, that to me,
story, so tough. Yeah.
It's really hard. And so to me, it highlights, and unfortunately that's 2 examples of hundreds that, over the last several months of people who are just really hurting, folks who are worried about losing their house. Or I talked to a small business owner in Tacoma who said, I spent 30 years building up my business. I wanted to pass it on to my kids. We just can't make it. And so to me, that highlights the need for the federal government to have a response that steps up to that need, certainly from the public health standpoint, but also making sure that we're helping that small business owner and that we're helping the person who's been made unemployed or who's struggling with nutrition or housing. And again, important to underscore, and it's not their fault, right? That this is something that was beyond their
You did
control.
wrong. Yeah, yeah, exactly. Well, tough stories to hear, and we wish you well on moving ahead and getting something done. For everyone. I think we experience in our own lives. And you're right. I do think a bit about. So I'm a member of Congress. What would I be doing now to help my constituents and to speak up for them? So thank you for doing that. Switching gears to healthcare, obviously that's the audience today, and there will be consequences from the COVID for economically in terms of loss of insurance and coverage and all those sorts of issues. But you talked a bit it's a couple months ago now, when we talked about your own understanding of how important Medicare is to you and your family. And I have to say, really, your understanding of Medicare Advantage too. We'll talk about that in a minute. But tell us why you care so much. I mean, you're on appropriations. When that you deal with healthcare issues, everyone does as a member. But tell us a little bit about what compels you around protecting Medicare and the promise of Medicare.
Well, I think about it through the lens of my own family. Unfortunately, we lost my Oma last year. She was 13 days shy of 109 years old. And, her husband, my grandfather, died in 1984. And so, 1981. So for really 38 years, her ability to live with dignity was really driven by, in my view, two of the great public policy programs in the history of the world, Social Security and Medicare. And in my time in Congress, I think because of that, I've made it a real priority to ensure that we're protecting these programs and building on the success of these programs, and ensuring that Medicare Advantage participants can get coverage, can get care that provides the best value to them and that best meets their needs, particularly during a public health crisis. And that's why I've joined my colleagues in calling on CMS to protect and strengthen Medicare Advantage. It's why you mentioned I'm on appropriations, why I've tried to use my seat on appropriations to stop any efforts to cut funding for it. And it's why I co-sponsored the Medicare Advantage COVID Treatment Act to waive those cost-sharing requirements for Medicare Advantage plan beneficiaries, for any treatment for COVID-19. We have to continue to fight for our seniors, including the Medicare Advantage beneficiaries in my neck of the woods. And we're lucky to have great partners like you and like the Better Medicare Alliance that are by our side in that fight.
Well, thank you. Speaking of that, one of the roles that you have taken on and was very active with the New Dems and New Democratic Coalition. You chair that. It's the moderate voice of Democrats in Washington, in the Congress, and it's grown. You have lots of members. Is it 100 members now? It's really quite something. So it's a very strong block of Democrats. I do know there's a spectrum on Democratic side as well as there is on the Republican side, but it's been really important for us at BMA to keep Medicare Advantage seen as supported by both Democrats and Republicans, and they sometimes do it for different reasons. But I know that as Democrats, you get pulled into these conversations: should it be all public? Should it go to a private sector? What about the role of the private sector? And you get the Republican side potentially going to maybe use potential lack of support for Medicare Advantage against Democrats. We haven't seen that yet, so I don't know that it comes up in the campaign, and we're grateful for that. But how do you see it going forward? Do you see Medicare Advantage maintaining that bipartisan support? And again, you've been we're thrilled about this. So, a player in being able to say that New Dems support public-private partnerships. We believe in the private sector being able to be innovative, and Medicare Advantage provides that opportunity in Medicare, which is fantastically important, but needs to be modernized too. There are ways to actually have more integrated care and less confusion and less fragmented care and better value for the dollar, and all things that New Dems talk about. So tell us a little bit about just how you see Medicare Advantage going forward and where that fits into an agenda of, a strong wish for universal coverage, as well as being able to use the private sector. So tell us about.
You are right that, the Democratic Party is a big tent. I think the good news is I think there's unanimity in the desire to see quality, affordable, universal coverage. And there's debate and discussion about what that looks like exactly, but having that as the North Star, I think, is not a bad thing. It's a good thing. I wasn't in Congress when the affordable I wasn't in Congress when the Affordable Care Act passed, it undeniably makes a whole heck of a lot of progress for the folks that I represent, including by bringing Medicare Advantage more closely in line with traditional Medicare. And we've seen a fair amount of correspondence related to some of these changes, including from the many folks who rely on this coverage to receive health services and resources that they need. So it's part of the reason that I've stood up, whether it's signing on to the bipartisan letter to CMS, where we urge the agency to protect and strengthen Medicare Advantage, or opposing any effort to cut funding for it. To me, it matters that everybody, and certainly based on my family experience, that seniors have access to a healthcare plan that fits their needs. And I think Democrats and Republicans can and should agree on that. I think there's a lot of bipartisan support here, Allison, and I think folks who are watching this should continue to make their voices heard, continue to make sure that their elected officials know where they stand. And I know the Better Medicare Alliance does, I think, a really fantastic job to make that happen. As I said earlier, there's 35,000 folks enrolled in Medicare Advantage in my district alone. There's 24 million seniors and people with disabilities who are covered by Medicare Advantage. So I think it's up to everyone to let their representatives know where this is working for them. And if there's changes that need to be made to make it more effective, make it more constructive, we need to hear that too.
Yeah, absolutely. And we're always looking for how we can strengthen Medicare Advantage or do a better job or learn lessons. And that is one of the things that's great about Medicare Advantage, that those opportunities to really look at innovations and see what works and see what doesn't. And certainly you're right, under the ACA, most people don't know there was a hard decision to say we're going to actually bring MA more in line with the cost of fee-for-service, but continue to allow those flexibilities in extra benefits and really getting people valuable care. So really appreciate that. So broader look, this whole movement towards to more value-based care is one that we want to see momentum continue on. That's really important. But certainly, well, we don't necessarily want to talk what's going to happen in this election, and just will be a couple of weeks. But what are your hopes for healthcare more broadly? Where do you see the priorities in the next Congress? We can look ahead to that. I know there've been some bills proposed and some already sort of sitting there ready to go potentially, but. Talk about that a little bit, about what you like to see. Washington State's had some great healthcare and has been ahead of the curve in modernizing the way healthcare gets provided. So what are your expectations about the priorities for the next Congress?
Well, there's a few variables here. Obviously, the outcome of the election is one. A potential decision by the Supreme Court with regard to the Affordable Care Act is another. So the crystal ball gets a little fuzzy as a consequence of that. Having said that, I think perhaps the most obvious sense of where things could go is where things have gone under a Democratic House. We recently voted on a bill called the Patient Protection and Affordable Care Enhancement Act that was really designed to try to shore up some of the damage that had been done to the Affordable Care Act, and then to fix some of the things that need fixing and build on the success of it. So, decreasing premiums so that folks won't have to pay more than 8.5% of their income for a silver plan in the Affordable Care Act marketplace. Like that's, I actually think, a pretty important step forward. Expanding Medicaid coverage so more people can get care. That under that bill is expected to cover an additional, I think, 4 to 5 million people. Improving access to primary care docs. Trying to address some of the healthcare inequities by expanding coverage and premium assistance to Black Americans and Latino Americans, and reversing some of the damage that's been done by this administration with regard to junk plans and things like that. So I think those are I think those are some things that, while those aren't moving in the Senate right now, those could move in the new year, and I think would have a Senate hopefully and a president hopefully that would want to see those improvements made.
That's great. Well, I should close by just thanking you for being one of the champions of the year for Medicare Advantage. Really wanted to give you that acknowledgement for the good work you did. And I should say, not sure we would have seen that all the premiums for seniors protected with when the insurance tax was repealed. And I know you had a behind the scenes quiet hand in pushing that over the finish line. So thank you very much. There are millions of Americans and certainly millions of seniors who thank you. And we do too. So thank you on the behalf of BMA and, for your good words, and wish you the very best with the new Dems. They're going to continue to be a really important part of this next Congress. And well, you have work to do a little bit before then. So between now and the end of the year, best wishes and take care. Best to your family.